HealthProm works with local partners for the health of mothers, children and families.
I'm Dr. Hussein Ali Jahid, working for HealthProm, managing and implementing the project of decreasing maternal and newborn death in a remote and mountainous district in Charkin, Balkh province, Afghanistan. Afghanistan is a country with the highest maternal mortality and newborn death, whilst most of the birth and death are taking place in the village and are not registered. The Health Ministry has announced the rate of maternal mortality 1,600 per 100,000 live birth, and the rate of newborn death 153 per 1,000 live birth. The project is going on in coordination with the Health Ministry in Afghanistan and in partnership with CHA, Coordination of Humanitarian Assistance. CHA is a non-profit, non-sectarian and non-political organization which is established in 1987 by a team of Afghan educated volunteers.
CHA is contracted to deliver a basic package of health services in Charkin and all over the Balkh province. The main aim of the project is to achieve Millennium Development Goal 5A, to reduce by 3/4 the maternal mortality rate by 2015. We aim to show that this can be done in Afghanistan, and how. The project is fully participatory. Project facilitators, who are trained in participatory methods locally, ride motorbikes to travel to the villages. Facilitators also have to walk to reach villages of the mountain. The male facilitators meet with the village men and set up men's support groups and inquires them to devise the steps to solve their own health problems. The female facilitators meet the village women at different places, at home, at work, on their farms. They set up safe motherhood groups and encourage the women to play an active role in solving their health problems. The facilitators help the villagers to draw up a social map of their village. The map shows the population and all of the village infrastructures, so it gives an opportunity to the villagers to recognise their health problems, and this points the way to find how to solve them locally. The facilitators have set up 46 safe motherhood groups and 20 men's support groups in 20 villages in Charkint. The groups are encouraged to send their heads to the monthly meetings with the project administrator in Shah at the centre of the district. In the meetings, the heads of the Safe Motherhood women's groups and men's support groups report the number of births and deaths in the village, receive health messages and discuss their health problems. As infection and heat loss are known as the major killers of newborns in Charkint, so HealthProm provides every pregnant woman with a clean birth kit and baby blanket to make it sustainable that the villagers are able to continue in the future. The heads of safe motherhood groups make up clean birth kits from material found locally. The clean birth kits contain squares of cloth and plastic sheet, a bar of soap, a razor blade, gauze pad, an adhesive bandage and string. They also make baby blankets out of full-size blankets. To encourage the heads of safe motherhood groups and to help them with their livelihoods, HealthProm provided each of the heads of safe motherhood groups with a hand-driven sewing machine from China. It was a great challenge for the poor village women in labour to travel on donkeys or horses for 2 to 6 hours to get to the health centre for childbirth, especially in winter when the last tracks are covered with snows, or in spring when it is destroyed by floods. So HealthProm has provided a vehicle for emergency transport for women in labour, transferring the women from village to health centre and, when needed, from health centre to hospital in Mazar City. HealthProm is also working with the villagers to make a low-cost means of emergency transportation for the villagers to be able to use when the project ends.